So I know there's so much to go over related to DBT, and we only have an hour. So I'm going to go through some basics and then leave some time for questions as well. Basically, this presentation is going to focus on a brief overview of what DBT is, a couple of the foundational aspects of DBT. I'll talk a little bit about behavior therapy and how behavior therapy is one of the foundations along with Zen Buddhism. Those are the two primary foundations. And then I'll just explain a little bit about what Zen Buddhism is for those of you who haven't heard about it. And then at the end, I'll give you 2 skills that you can use right away with clients for crisis management so that you can put DBT into practice. So first off, for anyone who is not familiar with DBT, it's Dialectical Behavior Therapy. It was developed by Marsha Linehan in the 1980s. And fun fact, Marsha Linehan actually had borderline personality disorder. So a lot of the model was based on how she conceptualized it from her own personal experience and the aspects that she felt needed to be addressed. So for that reason, I think is probably one of the reasons why it is so effective, because it was developed by somebody who really understood the illness. A lot of people know that DBT works really well for borderline personality disorder, but also an interesting fact was that the first grant for testing DBT was actually with chronically suicidal females. It wasn't with borderline personality disorder. So the first research grant showed that using DBT, we were able to prevent suicide attempts, dramatically reduce them. And then from there, Marsha Linehan went on to test this with people with borderline personality disorder. But now in 2020, we have research that backs up the use of DBT across the board with pretty much every psychiatric disorder. There's nothing that wouldn't benefit from DBT. And they even use it in schools as skills training, even as low as elementary school. They'll use it in organizational psychology as far as bringing it into businesses and training employees to interact with each other. So the skills are really used across a variety of settings. So the foundations are really the concept of dialectics, and then behavioral science, and then the Zen practice. And those 3 things combined is what makes DBT different, from other treatments. So dialectics, the word dialectics is the balance of opposites. So the idea that 2 seemingly opposing forces can exist at the same time. For example, I can love and hate someone. I can be sober and want to drink. And so the main dialectic that runs through DBT is acceptance and change. They seem opposite and they're not. We can accept something and change it. So these are the 4 modules of DBT that I have listed here. And 2 of them are acceptance-based and 2 are change-based modules. So the mindfulness and distress tolerance would be more of the acceptance-based modules, helping the clients to be aware of the present moment and tolerating the situation and the moment without trying to change it. And then we have our interpersonal effectiveness and emotional regulation, which are more change-based modules, where the clients are able to identify emotions and change the emotions that they'd like to change, and also change dynamics in relationships by changing their own behavior. So according to an actual definition of dialectics, this is our dictionary definition: the art of investigating or discussing the truth of options, inquiry into metaphysical contradictions and their solutions, the existence or action of opposing forces and concepts. So when you're thinking about dialectics, this is just some ways to, for me, my brain works in a way that's a little bit black and white, which is kind of the purpose of DBT, is to help us to not be thinking so black and white. So it's hard for me, and it almost like hurts my brain when I try to think that 2 opposing forces exist at the same time. So this is very helpful to me to think that dialectical means that 2 ideas can both be true. Like, I don't have to be wrong for you to be right. We can both be right. We can both be somewhat right and somewhat wrong. And what happens automatically when we approach something with a dialectical perspective is it takes out a lot of the conflict. It's hard to be in an argument with somebody if I'm not saying that you're wrong. I'm just saying what my opinion is, and I'm saying that we can both have an opinion and we can both be right. So it's hard to fight with that. So right away, it helps us with our interpersonal effectiveness. If we can just kind of remember that there's always more than one true way to see a situation. Like sometimes we'll think we know something 100%. Like, you know, one of our coworkers will be late to work and we make an assumption that, oh, well, they just don't care about being on time. They don't respect everybody else to be on time. And then they come into work and we see that they have a flat tire. And then all of a sudden it changes our conceptualization of what's occurred, you know, and before we would have sworn like, oh, they're just a disrespectful person. So when we use dialectics, we can think there are other ways to see the situation, and our initial assumption is just one way that we could see it. And then also it helps us value people because we can see that everybody has something unique to teach us. You know, rather than making everything an argument or a debate, we can be open to listening to what the other person has to say, and then also being able to give back our own opinion. So it becomes more of an exchange of ideas and opinions versus a tense argument when we're interacting with someone and we don't technically agree. One of the overarching goals of DBT is to have what Marsha Linehan calls a life worth living. So in Dialectics, she points out that a life worth living has comfortable and uncomfortable aspects. So we also need to be able to balance these things in our life to have an enjoyable life. To have happiness, we have to have some sadness. And to have fear, we have to have ease. And these things should, you know, balance. So Dialectics creates that balance. And also she asks us to look for the kernel of truth in other people's opinions, just so that we can see that all points of view are true and false. So I'm just never going to be 100% right. I'm never going to be 100% wrong. And, you know, everybody has their own reality. So it really is just respecting that everybody has their own filter through which they're seeing the world. So to practice being dialectical, these are some ideas these are some, you know, pointers to help you practice it. So like I said before, letting go of that black and white thinking, letting go of that self-righteousness. Sometimes we really cling to being right just because we don't want to admit that we might be wrong, or that there might be something, there might be a little bit of truth on the other side. I notice a lot of this with, you know, social media, political arguments, things like that, you know, that real self-righteous indignation. And when we come across self-righteously to others, it automatically shuts down any effectiveness that we could have. If I come across telling someone they're wrong and telling them why I think they're wrong, they're not going to listen to me and they're not going to care what I have to say. So being able to approach the situation more inquisitively and wanting to learn about the other person's perspective, then maybe I can sneak in some of my ideas and maybe they'll accept some of them or take some of them. But it's a much more gentle approach that is actually in the long run more effective because it creates less defensiveness on the other side. We also want to validate the other person's point of view. So even if we don't fully agree with the person, to be able to say, it makes sense that you feel that way given what's happened to you in the past, or it makes sense that you feel that way given the type of job that you do. However, we can make it valid to them in their context can be really helpful. So, you know, for example, when the person came into work and they had a flat tire, if I say to them, oh, wow, I thought that you just were disrespecting everybody again, and they could validate me and they could say, well, it makes sense that you would think that since I'm late almost every day, but today I actually had a reason. So they're validating me, saying, yeah, it makes sense why you make that assumption, and also that wasn't exactly what happened today. We want to be able to depolarize, which means that even if we can get to the point where maybe we think we're 99% right, as long as we're not on that 100% and we can see like a tiny bit of the other person's perspective, that's all we're trying to do. That makes compromise possible. As long as we're in that state of 100% blame, then we're never going to get there. We're never going to work out any issues. So these are just a couple examples of what dialectics is. I've worked with a lot of clients who, were abused, sometimes by their parents, so an example would be, my dad was abusive and I should cut him off. I shouldn't love him. But the dialectic way to see this is that your dad was abusive and you still love him. So those two things can both exist at the same time. The other example, Joe's saying, I know my girlfriend loved me during our relationship. My parents say that she took advantage of me and the relationship was fake. So both of those could also be true, because often people have different perspectives and have different motives throughout a relationship. So at some points, she could have taken advantage of generosity and also loved you. So it's just a way to be able to, I see a lot of clients really struggle with going back and forth, in their mind. Like as we're in a session, I can see that, like, for example, with the abusive father, I can see the client going back in their head, like, I'm not going to talk to him anymore, but I love him. And like, he's my dad, and like having memories of good times and then saying, but I need to cut him off because of what he did. And that like mental back and forth is very overwhelming. And the dialectics, you can see the relief on the client's face when you say, well, couldn't it both be true? Like, they always seem so shocked when I say that. Well, couldn't it be both? And they're like, oh yeah, like I didn't even think of that. Like, we're always so caught up in thinking it has to be one way or the other. And then that dialectics really gives you a break to be able to say, okay, it can be both. And it also takes the judgment off of, like, for this example for Karen, I mean, if she still loves her dad and he abused her and she feels like she shouldn't, then she might really have a lot of shame and guilt for still loving him, even though he was abusive. So when we use dialectic thinking and say it can be both, then that also reduces the guilt and shame that she's feeling for still loving her father, which is a natural feeling to have. So we can validate that and say it's natural that you still love your dad because he's your dad and he's the only dad you have. And, also it's valid that you feel angry about what he did. So dialectics in combination with behavior therapy is what creates DBT. So the behavior therapy part, I'm sure everybody's familiar with B.F. Skinner and radical behaviorism and everything, so I won't go through that. But what we've adapted with DBT is that we focus on the current problems. So rather than going back in the past, which there are different stages to DBT therapy. So in stage 2, we actually will go back and do some trauma treatment. But in stage 1, we're really focusing on current problems and factors. Like today, right now, what is the issue? We're really trying to stay in the moment because especially when clients have borderline personality disorder or other emotional regulation disorders, it's overwhelming to go thinking about the past or the future. So we just try to use mindfulness, what's going on today. And we want to try to use behavioral techniques to change the client's behavior. Also, the client has to take an active role. So we give homework. A lot of the skills that they're learning is really on them. I always tell them 10% is what I'm teaching you. 90% is your ability to practice it. So if you're not doing the homework, you're not going to learn it. So that puts a lot of the responsibility on them. It's a lot of skills presentation. So you're really treating the client as an equal because you're training them on skills. It's not really a position of authority where the therapist is like, over the client or anything like that. It's very collaborative. And we're trying to empower the client to believe that they can practice the skills and not use the ineffective behaviors they were using before. And then we assess the target behaviors. In one of the first sessions, what I do is I ask the clients, what are the target behaviors? Like, what behaviors do you want to change that are causing you problems right now? And usually it's going to be suicidal ideation, self-harm, substance abuse. So first they'll, identify the more life-threatening, serious things that are complicating their life. And then as we move on in therapy, I have a client I'm working with now. His main target behavior is over texting his friends. If he doesn't get a response, he feels anxious, he's emotionally dysregulated, and he'll repeatedly text until he gets a response. But sometimes the text will escalate in what he's saying just becomes more and more inappropriate. So it will actually push people away because eventually he'll say, why aren't you writing back to me? I know you hate me, and that kind of thing. So it pushes the friends away, where if he could just manage that anxiety of not having the immediate response, then he wouldn't sabotage his friendships. So that target behavior is what we're working on right now. And last night he was using phone coaching with me and texting with me and telling me, I really want to call this person. I really want to text again. And, you know, I was just giving him the direct, you know, feedback and instruction to not do that, and just reminding him, like, this is going to ruin your friendship if you send one more text message. And then this morning he texted me and said everything was fine. He got through it and the friendships are all intact. So the phone coaching is really helpful for the clients, because in the moment, I mean, if he had to wait until the next time we have an appointment, he would have already ruined the friendships. So having that phone coaching is really helpful. So what we do in each session then is we go over the target behaviors, and the client's able to point out when they had target behaviors during the week if they didn't use coaching. Otherwise, I'll already know about it. And then we use, now behavioral therapy is very into like scientific method and being very systematic. So we're very systematic also in how we address the target behaviors. We have something called a behavioral chain analysis. And with the behavioral chain analysis, we look at the target behavior, what were some of the factors, we call them vulnerability factors, that led the client to be more vulnerable to engaging in that target behavior, and then what were the links that led up to the behavior. So for this individual, the vulnerability factors would be he's in medical school and he's studying 16 hours a day, he's not sleeping enough, he's not eating well, and he's feeling frustrated. So those are the vulnerability factors. And then the triggering event would be that a new person joined his study group. So any kind of change for him is very triggering. He just doesn't do well with change. That's another aspect of borderline personality disorder. So the person joining his study group, it made him feel jealous. So the links, sensation links would be increased heart rate, increased sweating. Emotion link would be anxiety, jealousy, and fear. And then the cognition links would be, my friends are going to like him better than me. I'm going to lose my friends. I'm going to be by myself. And so after he has those cognitions, then the target behavior comes of, you know, repeatedly sending those texts to reassure himself that he didn't lose his friends and that everything's okay. So when we look at the behavioral chain analysis, we're able to go back and say, okay, where could we intervene with that? Where could we insert a skill instead of the over texting? So when he used the—
I have a question here.
Yeah.
That was an awkward interruption, but we have a question from Diana. Phone coaching, please explain that more. Sounds like being a school counselor. How do you set up boundaries in this as a DBT practitioner? Sounds psychoeducational too.
Yeah, okay, so DBT is a lot of psychoeducation. The phone coaching is definitely not phone therapy in any way. So the clients are told in the beginning, the phone coaching is 5 minutes, if that. And also with this, and it's up to you to set up your own parameters. With this person, I'm okay with him texting, but he knows that, you know, don't text me, I'm gonna commit suicide or something, because I might not see the text. So we have parameters and rules set up for that, but he's allowed to text me with situations that come up if that's easier than calling. Usually the client traditionally will call you on the phone and they'll say, I need coaching. And you'll say, what skills did you try already? And they'll say, I tried this one, this one, this one. And then you just give them 3 more and you say, try these 3. If it doesn't work, call me back. So it should be a very quick conversation. It's really only to coach them on skills. So if they've forgotten the skills or if they're too emotionally dysregulated in the moment, you just give them those skills and that's it. You don't go into talking about what happened, what upset them. Like, you really try to just not get into any kind of phone therapy. It's just skills. Any other questions at the moment?
At the moment, we are good.
Okay. So let's see. Oh, okay, so we want to be able to insert a skill that is more effective from our DBT skills instead of the target behavior. So like last night, when he was texting me, I gave him skills to use, you know, when he was saying, I'm really dysregulated, I'm going to use drugs, I need a Xanax, I'm going to text this person, I'm going to call them. I said, go pick a movie on Netflix, go see what Netflix has as a movie, which is the distraction skill. And then I said, drink a cup of hot tea, which is self-soothing. It's soothing through the senses, through smell, taste, and touch. So I'm giving him different skills from DBT to use. And basically I just overwhelm him with skills, because sometimes they'll say, well, that one's not going to work, or I don't want to do that one right now. So I'll just keep sending skills, do this one, do this one, do this one. And then eventually they'll be regulated because the skills work. So, I mean, I've had only one situation where phone coaching turned into me having to hospitalize a client. Usually that won't happen because I'm able to give them the skills and they're able to use them. And that one event only happened because the person was under the influence. So I couldn't trust that they were really regulated. So phone coaching, I think, really prevents a lot of hospitalization, and DBT overall prevents a lot of hospitalization. That's one of our major goals of DBT, is to reduce inpatient hospitalization. We want to be able to treat the client in the least restrictive environment. So we use these conditioning techniques in DBT. I'm sure you're all familiar with them. We've got our positive and negative reinforcement, our extinction, positive and negative punishment, and so what we do is, after we finish the behavioral chain analysis, then for this example with the over texting, I would say, if he actually engaged in the behavior, then I would say, okay, well, what happened after? What was the immediate consequence? And he would say, well, right after I sent the text, I felt better. My anxiety went down, my heart rate went down, I wasn't sweating anymore, I felt calm. And then what happened after that? Well, I didn't get a response, so my anxiety went higher than it was before. So then the client's able to see that even though that sending that text did actually effectively reduce the anxiety, it was very temporary. And then it went back up because you didn't get a response. And what happens too is that sometimes it's reinforced. So I don't know what would have happened last night. I told him not to send another text. But if he did send another text and he got a positive response from the friend saying, don't worry, I still love you, we're still good, we're still friends, that would have really been damaging to the therapeutic process, because then he would think, oh, well, that's what I have to do. I have to send 10, like, you know, overwhelming text messages to this person and then I'll get a response. So as much as we can, and it's usually more with family members, I wouldn't reach out to this person's friend, but if it's a family member reinforcing a behavior, I will address it directly. Like I work with a 16-year-old and I talk to her parents weekly, and I let them know, you need to stop this behavior because it's reinforcing the behavior you want her to stop. So that's a very, very scientific and direct, you know, when, like I have a client the client that's 16, she doesn't want to go to school, and she was self-harming in the morning, and then her dad was letting her stay home from school. And I said, no, if she self-harms in the morning, you need to drive her to school. Like that's not going to excuse her from school. You know, and once we implemented that, she stopped self-harming in the morning because she realized, oh, self-harming is not going to get me to stay home from school. So sometimes the solutions are very simple and able to be changed by changing the environment and the reinforcers. Also, I just mentioned to be aware of extinction burst, because sometimes we get uncomfortable with that and we give in, and there's always an extinction burst. So when we're trying to change a behavior, for example, if this client was over texting me, I would ignore it. But I have to be prepared that I'm going to get some intense text messages before it stops. So I can't give in on the 15th text message, because then I've just reinforced that it takes 15 text messages to get me to respond. So then I'm in for it for the rest of the time we work together. I'm going to be getting 15 plus text messages every day. So once we commit to not giving in and reinforcing, we have to stick to it.
Michelle, one more question.
Sure.
A couple more questions now. One from Diana. Does DBT teach a list of specific skills for specific diagnoses, or does each practitioner have to come up with their own lists of skills?
So DBT is a manualized treatment. So there's a skills training manual, and all the skills are in the manual. And they should be taught in, if you get there's also a skills training manual for the professional. It's actually called the DBT Skills Training Manual. So that one tells you which ones to pick. You can pick and choose as you want, or you can teach all the skills. When I go through it, I just teach them all. And then I'll let the clients decide which ones work best for them. So I just present them with all the options and then let them choose.
So maybe this would be a good time to explain, if fully implementing a complete DBT program, what does that look like with the groups and the individual sessions and the texting and calls and that sort of thing?
So there's, when we have DBT, we call a full program comprehensive DBT. So what's included in comprehensive DBT is individual DBT sessions, which are structured sessions. They're structured in a very specific way. Every minute is basically accounted for. So that it helps a lot with people who are emotionally dysregulated, because a lot of times they'll go off of the topic, or they'll just keep talking about different emotional things rather than problem solving the issues as they're coming up. So we have the structured individual sessions, and then the DBT skills training groups. And what I do sometimes is I do the skills training also somewhat individually, especially now with everything that's going on. I've had to modify things a little bit with COVID. So I'll do the individual skills training instead of group sometimes if people want individual training. So I just do it as if I'm running a group, but just with one person. And then we have the DBT phone coaching, which is the third piece of comprehensive DBT. And then the fourth part of comprehensive DBT is that therapists must be a part of a consultation team. So you can't say you're doing DBT unless you have those comprehensive pieces, and you have to be on that consultation team.
And we have a question from Amy. How do you deal with the extinction burst with regard to the self-harming client?
So if the client uses the self-harm as a threat, like if they were to say to me, if you don't respond to me, I'm going to self-harm, I would let the person know. I would say, in that case, I would probably call them, and I would say, if you need hospitalization, I will call and have you hospitalized. And before this would even happen though, like there's something called commitment session, which happens in the beginning of DBT when you're first meeting the client. That would be something that would be explained in the ground rules, where I would say, if you threaten self-harm in that type of fashion, like during the phone coaching, I will not speak to you for 24 hours. So there's already something in place from the beginning, so you can kind of avoid that. But I did have that situation because last night this client texted me, goodbye, I'm done. And so I texted back immediately, don't text me things like this. And then I said, I will send the police to your house. And then he immediately texted back, I'm sorry. So I think that it's just having those really firm boundaries, like because he already knows he's not to text me anything about self-harm or suicide. Like that's something that we need to speak of on the phone, because I need to actually hear you and hear what's going on in the background and fully assess the situation, not over text. So if I got a threatening message like that, that's how I handled it, is I just immediately set a boundary.
Great, thank you.
All right.
That's all we have for right now. So.
Okay. So with our traditional therapy, prior to DBT coming out, CBT was really the therapy of choice prior to that. And some of the problems with those traditional therapies were that the clients were really sensitive to rejection and invalidation. So, you know, in CBT, we talk a lot about thought blocking and thought replacement. So for somebody who has borderline personality disorder, to tell them their thought is wrong and they need to replace it can be very damaging, because they already feel guilt and shame for their thoughts. So then somebody on top of that is saying, well, yeah, like you kind of should, and you should change that thought because it's bad. So that's why we kind of balance the acceptance and change in DBT. We say, you know, you're allowed to think anything you want, and you can change the thoughts if you want to. So it's kind of just putting it more on the client and not making it one way or another, like, oh, the thought's bad and you have to change it. It's more like, accept the thought because we can't always control our thoughts, and you can change it so that you don't ruminate on the thought. So we're just balancing that acceptance and change, whereas in CBT, it's more of change-based. Also, because some of the clients with borderline personality disorder and other personality disorders, they were really suffering in their current moment. So being completely in acceptance was too much for them. So telling them they had to change and also telling them they had to accept how things are, that those are both very overwhelming. Because if my moment right now is so intolerable and my therapist is telling me I just need to accept it, then my immediate thought is going to be, well, I just want to end it. Because I can't, if I have to accept the way that I feel right now, it's horrible and I can't deal with it. So having that balance with the acceptance and change, I can say to the client, there are some pieces of your reality right now that need to be accepted because we can't change them. And there are some pieces that we can change. For example, clients don't love to be in treatment. So I'll tell them, you know, yeah, you're in treatment, that sucks. You know, I'm sure you don't want to be here. What can you do to make this as pleasant of an experience as possible today? Like, can you get together with your roommates and make dinner together? Can you order some ice cream, eat ice cream with your roommates later? You know, so trying to just come up with some things that we can change, little things that will help them to be able to see that things are there is something positive coming. Because if you just say, oh yeah, you're in a horrible situation right now and you just have to deal with it, that's like not a good thought, and it can make the client really anxious. So DBT uses Zen because Zen's not a religion. It's really compatible with behavior therapy, and a lot of the Buddhist teachings support the whole mental health recovery process. So there are a lot of teachings. I didn't go into all of them, but I just mentioned the Four Noble Truths, which are the truth of suffering, the truth of the cause of suffering, the truth of the end of suffering, and the truth of the path that leads to the end of suffering. So this is really a lot of what Marcia has based her mindfulness on, you know, accepting that there is suffering, also realizing that suffering is caused by our resistance to accepting reality. So we can reduce our own suffering by accepting reality and making the changes that we can make versus being fixated on wanting to make changes that we can't make. So what we do need to accept is reality as it is. We don't need to accept emotional states and things like that because we can change them. So knowing what we need to accept and what we can change, kind of like the serenity prayer, is really important for DBT. Since our overarching goal is to have a life worth living, these principles really guide us to that. And anybody who's studied you know, Buddhism in any way, you know, like a lot of the teachings just really increase happiness, increase self-awareness, and reduce painful emotions. We are automatically happier when we are mindful because we're in the present moment. For the most part, given some exceptions, the present moment is usually tolerable. What makes things intolerable is when we think about a past intolerable experience, or we project about a future experience that we feel will be intolerable. So it's more the depression from the past or the anxiety about the future that causes us emotional dysregulation. In this moment right now, we can probably tolerate what's happening. So when you think about, for example, with trauma, if I have a client who experienced an attack, an assault, they're not being assaulted right now, you know, so they can tolerate this moment. It's their memories from the assault that caused it to feel intolerable, and then the worry that they're not going to be able to stop thinking about those memories. So, but in the moment, if they just focused on this moment, they would be able to tolerate it because they're safe and in a secure environment. So we can really tolerate our distress that way. And so these are the two skills that I brought with me for crisis management, just so that you can implement some of them right away. So the first one is the tip skill. This comes from our distress tolerance module. And in distress tolerance, we have crisis survival and distress tolerance. Those are the two sections of the of that module. So the tip skill comes from crisis survival. So this would be used if the client is having what they consider to be a crisis, and everyone's crisis is different. I usually try to use a scale of 1 to 10. If the client is feeling like their emotions are at an 8, 9, or a 10, that would be in that crisis range. And then when they're in that crisis range, it's more difficult to use other skills, because when we're very emotionally dysregulated, we can't always focus on thinking. Our cognition is clouded. And so as far as using the interpersonal effectiveness skills, if I'm very angry, if I'm all the way at a 10, it's probably not the best moment for me to go talk to my boss about what I'm angry about. I might want to regulate myself, bring it down to a 6 or a 5, and then go address it. So in order to get it down from a 10, the tip skill is pretty much the favorite. It stands for temperature, intense exercise, paced breathing, and paired muscle relaxation. And the temperature one is the one the clients like the best. So traditionally, it's to dunk your head in a bucket of ice water. Now, you don't always have access to a bucket of ice water, but if you do, that is the preference. It'll also work if you melt ice cubes in between your wrists, or if you put ice right here, or even on your forehead. If you were to jump into a very cold body of water, that would work. Or if you were to jump into a really cold shower, that could work too. But the point is that you want to change your temperature, because when we become emotionally dysregulated, our temperature increases, our heart rate increases, blood pressure increases. So what we want to do is bring those back down. We want to cool our body down, lower our blood pressure, lower our heart rate, lower our respiration, and then it tricks our brain into thinking that we've actually calmed down, even though we didn't really calm down emotionally. So that temperature is like faking out our brain. So in order for it to work, we want it to be really cold. It also works the same with the intense exercise. So if I feel very emotionally dysregulated, again, my physiological arousal is high, my blood pressure, heart rate, respiration is high. So if I start running, then all of a sudden that makes sense to my body. Like, well, your heart rate should be high, your blood pressure should be higher, and you should be sweating because you're running. So your body almost, it fits, with what you're doing. And then when you stop running, you just do sprints for maybe 30 seconds, just a couple sprints. And then when you stop, your body will automatically start to slow down physiologically, again, tricking your brain into thinking that you calm down. Paced breathing is just what it sounds like. This is, taking in slow breaths and letting out slow breaths. You can use box breathing as well, which is, I prefer box breathing. So that's where you count to 4 for your inhale, you hold for 4, breathe out for 4, hold for 4. And I find that the clients feel that that's more soothing than just attending to their breath, because sometimes that can increase anxiety. So the counting for 4 also serves as a distraction for what's going on for them. Then they have to focus on the counting as well as the breathing, and that's able to distract them enough to bring the emotional dysregulation down a little. And then the paired muscle relaxation is used with the box breathing. And that's basically when you tense up your muscles and relax them, sort of like a progressive muscle relaxation. And that, again, the tensing of the muscles and then relaxing them tricks your body into feeling like you're actually relaxing. So another skill that I use a lot, especially when I'm doing the coaching, is the self-soothing. That tends to be a really good one because there's usually distraction involved in that too. So like I said last night, I gave that client instructions to make a cup of hot tea, because that's going to activate your sense of smell, depending of how you make it, it could activate your sense of hearing, you know, listening to the kettle whistle. You're going to taste it, you're going to touch it and feel like the warm cup in your hands. And obviously your vision's going to be activated as you watch yourself make the tea. And if you're using the mindfulness skills during this, then you're really in the moment and aware of what's going on. And you can use the mindfulness skills are observing, describing, and participating. So as you're making the tea, you can say in your mind, I'm taking the cup out of the cabinet, I'm grabbing a tea bag, I'm unrolling the tea bag, I'm putting the bag in the cup, I'm waiting for my water to boil, I hear the water boiling. So as you're tracking all these things in your mind and being in the moment, that's helping you calm down, because it's called one mindful. And being one mindful is just really focusing on exactly what you're doing in that moment. And as the client does that, they'll be able to distract from whatever has dysregulated them. Of course, we don't want them distracting forever. So these are only skills that you use in a crisis, because after they get their emotion down to that 7 or 6, then you need to address the issue and go back and explore it and use problem solving at that point. So I'm going to open it up and see if anyone else has more questions, because I know we're getting kind of towards the end of time. So
We do have one more. Diana asks, how can you utilize this with clients who are religious? Some may shut down the minute they hear Buddha, unfortunately, due to the black and white thinking.
I think that's a good point. And I think that she doesn't talk too much about Buddha or Buddhism. I mean, it's in the manual for the provider, but as far as what's in the worksheets for the clients, she really just says mindfulness. And then she has like examples of what you can do for mindfulness practice. And she's very inclusive because, like she was saying, Zen is not a separate religion. You can combine it with other religions. Like mindfulness can be part of any other religion. So if you are into, you know, she recommends like contemplative prayer. So, you know, if you have prayers that you do throughout the day, at different times of the day, or, you know, if you're Catholic and you do a rosary, like any of those things can fit into the contemplative practice. So you can easily modify it, however, for whatever religious background your client might be. And I have a lot of clients who don't have a religious background. So I'm able to tell them, you know, do you exercise? Okay, well, that's a mindfulness practice then, because you can use the mindfulness, the breathing, awareness of what, you know, the current moment as you exercise. And there are a lot of mindful, what she calls mindful movement activities, including Tai Chi, yoga, capoeira. So there are a lot of different, you know, you can tailor it for any client.
And then James added to that, these techniques are common to many contemplative practice, many contemplative traditions. And I think that's true.
They're kind of what?
These techniques are common to many contemplative traditions. And I think that's true. Multiple religions utilize those contemplative approaches.
Yeah, and I think mindfulness is being utilized a lot more in general. I just hear about it more in different treatment centers and treatment practices. And, you know, so I think it's more widely accepted. I've never had anyone be offended with that. Sometimes they feel like it's going to be boring, but once I explain that, you know, meditation doesn't mean sitting cross-legged for 2 hours and like clearing your mind. Like that's not what this type of mindfulness is. Once they realize it's just being in the present moment, then they feel better about it.
Okay. And we have a few more questions coming in. Janice says, are there any other resources besides the manual for professionals you recommend for those of us who aren't intensively trained or certified in DBT to follow?
So I would still recommend that workbook is really good. I mean, if you want to use the skills with clients, and I'll show you what it looks like. Hold on. So you can find it on Amazon. So this is what it looks like. This is the DBT workbook. And then the other one is by Marsha Linehan. It's called the DBT Skills Training Manual. But before I had that one, I had another one too. It was what is it called? I think it was by Chapman, and it was a workbook. It was like a green and white pixelated looking workbook, and it was called DBT Training. And the client filled out the workbook. It was probably like that thick. But I found that that one was really helpful too. I use that a lot in my private practice before I was using this. It goes through a very simple explanation of some of the skills and almost gives them an ability to journal. Like there's some lines, you know, for journaling and writing in there. So that one's a good one too.
And then Amy asks for tip, is it preferable to use 444 or can one use 478?
It's really up to however you want to do it. I had a couple clients who they like the repetition of the 444, but then I had some clients who they noticed that they would go into almost like autopilot, and then they'd still be able to obsessively fixate on what was dysregulating them while doing the 444. So for them, we decided to change it up with different numbers to help them to stay in the moment.
And then David asks, what are some examples of intense exercises that you have found have helped a person in a crisis?
I mean, I usually tell them if they have room to sprint, I would sprint. If not, jumping jacks, maybe like burpees or like push-ups, maybe something that you could just do like in a small area.
Even jogging in place, I would imagine too. Let's see. How do you get a certification so a practitioner can be considered a professional?
How do you get a certification? Sorry.
How do you get a certification? I think she's speaking of the DBT Linehan certification. What's involved with that? So
okay. So the certification process, first you need to join a consultation team and be on the consultation team for 1 year. And then after that, you apply on her website. You can look up the Marsha Linehan website, and she'll tell you all what you need for certification. But you need, I think it's 42 continuing education hours directly in DBT. And then you need to take an exam. And after you take the exam, then you write a case conceptualization where you identify your client's target behaviors and some basic information about the client. And then you have to submit 3 videos for coding. So they will code your individual DBT sessions. As I said, they're very structured. So they make sure that you're using the DBT skills and that you are following that structure and in 3 videos. And then after that, you get the certification.
and the good news is that you can actually practice DBT before you're certified through Linehan. You actually need to in order to become certified. And I'm going to give you some information short how you can actually get the education that you need to implement that program with Michelle. I've got a couple more questions and then we will be basically out of time and close up. How do you respond if or when a client with BPD becomes very angry with you, blaming, threatening to stop seeing you, threatening to sue you?
So if a client was threatening me, so in DBT, they have something called the egregious behavior protocol. So there are specific things that you would do if a client's engaging in an egregious behavior. She gives you step-by-step of how you can deal with it. But basically, what you can do is, I mean, personally, if a client said they were going to sue me, I would let them know that I would just set boundaries and say, you know, if you feel like you need to sue me, then you need to call a lawyer and stop calling me. I'm sending you recommendations. These are the therapists that you can see. We are no longer working together. So I just won't tolerate that kind of behavior. Usually within the first couple sessions, we have a rapport that's built to where that's usually not going to happen. This one client that I was talking about before, he does make threats sometimes, but he would never threaten to sue me or anything like that. But he's made a couple of little threats here and there, and I'll just tell him, you know, if you send me another message like this, I'm not going to be able to work with you, and we're gonna have to find you somebody else. And usually, with DBT, we're depending a lot on the relationship with the therapist. Like, that's everything. So he has to want to work with me. If he doesn't want to work with me, it's not going to work. So a DBT is very much like, you can't force someone to be with a specific therapist. Like, they have to like you. And they have to be motivated, which is another thing. So a lot of these issues won't come up because to do DBT with someone, they have to want to do it. They have to agree to do it, and they have to agree to not die while you're working with them. So they have to make certain agreements right from the beginning. So that will prevent some of these situations from occurring.